All right, February is Heart Month, and we're trying to address that in a big way because we all need to keep those tickers working just right, especially when we start talking about pregnancies. Did you know that pregnancy really stresses the heart and the circulatory system? You may already know that, but we want to make sure that people know what to look out for, the risks and the potential complications. We've got Dr. Sheila Chhutani with Texas Health with us this afternoon. Thanks so much for being here.
It's my pleasure.
Now, you just got done dealing with patients today.
I did.
Okay, so you handle a lot of pregnancies, you see a lot of things, and I'm just curious, how common are heart problems when you're dealing with women who are pregnant?
You know, heart problems are really common in pregnancy. 1 out of 4 pregnancies, mortalities from pregnancy is due to heart health, due to cardiovascular disease.
I wouldn't have thought that, and I guess a lot of people don't think about this, and so that's why education, of course, is key. Is it just that a lot of these things are not diagnosed going into pregnancy, or do they happen after pregnancy?
You know, it's a little bit of both.
Okay.
There are women that have chronic hypertension, so that means that they have high blood pressure before the pregnancy. But pregnancy itself can induce high blood pressure, so it's so important to make sure that you're getting your prenatal care and having your blood pressure checked regularly to make sure that that's not happening during your pregnancy.
It makes a lot of sense that blood pressure can go up during pregnancy because everything is changing in the woman, and you know, you've got all of this pressure that's being applied right here in the middle of the body there. What are some of the complications for a woman if she has high blood pressure, either before, during, or even after pregnancy?
So before pregnancy, complications can include number 1, trouble getting even pregnant because certain medications that you're on. During the pregnancy, you want to make sure that the baby is growing okay. You want to make sure that you don't have other complications. Whenever you've got high blood pressure already as a baseline, then you're at risk for preeclampsia, eclampsia, stroke, kidney disease. And so those are all things that we need to look out for. And then after the pregnancy, all of those same things can still happen. So just because the baby is delivered does not mean we're out of the woods. We need to continue to be vigilant and make sure that nobody has a stroke afterwards or has seizures afterwards or has kidney disease afterwards.
And you've actually seen these things happen. I mean, this isn't theoretical. Yeah.
Unfortunately, yes.
Yeah. And the important note here, though, I think, is, you know, those regular checkups and also going in or, you know, calling the doctor when something feels off, or if you're, you know, a family member and you notice that something seems off with someone who's pregnant, to go ahead and make that call, because all of this, or much of this, is very treatable.
Oh, absolutely. Some of these maternal deaths really did not need to happen. And so checking your blood pressure at home, if you don't feel right, always err on the side of calling. If you have a headache that's not going away with medication, if you start having visual changes, pain in your upper right area, basically underneath that right breast where the liver is, all of those are signs to call your doctor, and always err on the side of calling your doctor.
It's really tragic, though, when you say that, you know, the deaths that occur during pregnancy, so many of them didn't have to happen because of issues like this. It was just a matter of getting that care and getting it in time and identifying this and treating it.
Absolutely, and it's always great to be an advocate for yourself. If you don't feel like something is right, make sure you let somebody know, and if you don't feel like they're listening to you, really make sure that you're taking it the step further, and whether it's going to the emergency room or something, because you really want to make sure that those things get treated. It's so treatable.
Last thing I have for you before you go here, is there a particular group of women more at risk of high blood pressure issues in pregnancy, or is it any woman who gets pregnant, you know, may be facing this?
Any woman may, but you're at increased risk if you're obese, if you have a history of high blood pressure, if you have a history of diabetes or have diabetes of pregnancy, if you have underlying kidney disease going into pregnancy. Those are all risk factors. And so, and then age also. The older we are, and we see a lot more women who are older getting pregnant, that puts you at increased risk for having high blood pressure during the pregnancy, so you definitely want to be monitored.
Dr. Chhutani, thanks so much for sharing the wisdom. It's great to put this information out there, and it's great that we have this whole month to be able to get into these subjects that don't get a lot of talking time.
Absolutely. This women's health is my passion. I love taking care of the women and really being vigilant about heart disease also.
Very nice. Thanks for being here with us today. Really appreciate it.
Thank you.
Well,